Knock, knock.
Come in.
Hi, my name is Harmony. I'm going to be your student nurse practitioner today. Can I ask you what your full name is?
Karen Hall.
Hi, Karen. Can you spell your last name for me?
Hoang.
And what is your date of birth?
9/12/87.
Okay. And what's today's date?
January 21st.
And where are you?
In Worcester.
Okay. And how can I help you today? What are you here for?
A physical.
Okay, great. So I'll perform your physical today. I'm going to wash my hands first. Okay, so I'm just going to first inspect Karen's head and the skin on her face. I don't see any lesions. The skin is appearing to be dry and intact. There's no redness. Her head is normocephalic. Her hair is evenly distributed, and the quantity is normal and regular. There's no balding areas or anything like that. So next I'm going to ask for your hands, please, and I'm going to check skin turgor. She has good skin turgor. I'm going to check her nail beds. She has brisk cap refill, and I don't see any evidence of cyanosis. Next, I'm going to go to your scalp, okay? I'm going to feel your scalp. I'm going to look. I don't see any evidence of infestation. I don't see any nevi on the scalp. I don't feel any lesions or bumps anywhere. The hair is not coarse or dry. And again, the quantity is good and the hair is evenly distributed. Then I'm going to go to, I'm going to say that your eyes and your ears are symmetrical. I don't see any evidence of Down syndrome at all. I'm going to test your temporomandibular joint. I want you to open and close your mouth for me. I don't feel any crunching sensation. All right, I'm going to test cranial nerve number 5, which is the trigeminal nerve. And I'm going to put my hands right here, and I'm going to ask you to clench your teeth. Okay, and just try to open your jaw against resistance. All right, great. I'm going to test a sharp and dull sensation, which is also testing cranial nerve number 5, the trigeminal. So just for the purpose of this video, I'm going to use this pen light, but we're going to say that this is sharp sensation and then this is dull. Okay, so I'm going to test it on your forehead and your cheeks. I'm going to have you close your eyes and you tell me which one you feel, sharp or dull.
Sharp.
Okay.
Sharp. Dull. Dull.
All right, good. All right, so now I'm going to test cranial nerves number 7 and 12, which are facial and hypoglossal. So I'm going to have you just close your eyes for me and squint, please. There you go. And wrinkle your forehead. And okay, you can open your eyes. Now smile and frown and puff out your cheeks and stick out your tongue for me. Great. All right, so so next I'm going to test cranial nerve number 11, which is the spinal nerve. So I'm going to test the muscles in your neck and your shoulders, okay? So I'm going to put my hand like this. You press against my hand, okay? Press against my hand. Good, good. And then I'm going to put my hands on your shoulders and you try and shrug them up for me. Great. Okay. So that's cranial nerve number 11. Now I'm going to go to your eyes. I'm going to look at your eyes and can you close them for me? All right, the palpebral folds look good. The eyes close totally. And the hair on the eyebrows looks full and they are symmetrical. The eyes are symmetrical. I'm going to look at them. The sclera, which is white. There's no redness on the conjunctiva. There's no apparent drainage. I'm going to palpate the lacrimal sac and you let me know if it's tender at all, okay? All right, no tenderness on the lacrimal sac. All right. right, so I'm going to check for visual acuity, which is cranial nerve number 2, which is optic. All right, so I'm going to use the Snellen chart for this, and on here it says hold 6 feet from the patient's eyes, but for the purpose of this video, I can't get far enough back. So I'm just going to have you tell me what the lowest line is that you can read.
E, C, T, P, N, L.
All right, and now close, just put your hand over one of your eyes.
Mhm.
All right, and read it again.
E, C, T, P, N, L.
And do the same thing with the opposite eye.
E, C, T, P, N, L.
All right, and that is 20/20 vision. All right, so I'm going to now continue to test cranial nerve number 2, and with the confrontation test. So I'm going to put my hands behind you. I'm going to wiggle my fingers, pull them forward, and you tell me when you see them, okay? This is testing your peripheral vision. All right?
Yep.
Great.
Yep.
Okay, very good. Now I'm going to test cardinal directions, and this test, cranial nerve number 3, 4, and 6, which is 6 is abducens, 3 is oculomotor, and 4 is trochlear. All right, so I want you to look at my fingers, and you follow them, okay, without moving your head. Just move your eyes. All right, very good. Now I'm going to test cranial nerves numbers 2 and 3. That's optic, and 3 is something. I can't remember the name of it right now. So I'm going to test perla, and direct and indirect or consensual response to light. All right, so I'm going to shine it first in this right eye once, and notice if the pupil is constricting. I'm going to shine it in the same eye twice, and then I'm going to look at the opposite eye when I do that and see if that eye is constricting or if there's consensual response. All right, so I would dim the lights. Okay, 1, I see this pupil constricting, okay? So I'm going to do it again, and I'm going to look at this eye. Yep, it constricted. I'm going to do the same thing with this eye now. Okay, great. And so now I'm going to take the ophthalmoscope, and I'm going to find the red reflex. All right, the lights are dimmed. I'm going to find the red reflex. I'm going to follow that in. I'm going to view the optic disc. I'm going to take a peek at the arterioles and the veins. I'm going to get in closer than this if I was using an ophthalmoscope, but I'm not. So I'm also going to view the macula at the same time. And at the optic disc, I don't see any evidence of papilledema. All right, so I'm going to do the same thing with this eye. I'm going to find the red reflex. I'm going to follow it in to see the optic disc. I don't see any evidence of papilledema. I'm checking the arterioles and the veins, and I'm going to also view the macula. All right, very good. So I'll turn the lights back on. I'm going to check her ears now. They appear symmetrical. I'm going to palpate the ears, and I don't feel any bumps or anything or lumps. Tenderness at all?
No.
No, okay. So I'm going to look at the back of the ears. I don't see any open areas or lesions. All right. So I'm going to do the whisper test. Okay, so I would stand behind Karen, and I'm going to whisper a few words, and I'm going to have her repeat them to me.
1, 2, 3, 4, 5, 6.
Okay. All right. Now, in real life, if she did not pass that test, then I would continue with the Weber test, okay? And this is all testing the acoustic nerve, which is 8, cranial nerve 8. All right, so I'm going to hit this against my hand, and then I'm going to end up placing it on top of your head, okay? And you tell me if you hear it evenly in both ears, okay? Or one more than the other. All right?
It's even.
All right. So if it wasn't even, then that would give me an indication as to like which ear to go to, and then I'm going to perform the Rhine test, or the Renee test, okay? So I'm going to hit this again, and I'm going to place it behind your mastoid bone, and you're going to tell me how long you hear it for. Tell me when you can't hear it anymore, okay?
I can't hear it anymore.
Okay. Can you hear this?
Yep.
Tell me when you can't hear it anymore.
I can't hear it anymore.
Okay. So I would do the same thing with the other ear too. All right. So now I can take a look inside the ear. So I'm going to pull the pinna up and back. All right. I'm going to look in with my otoscope, and I'm going to view the tympanic membrane, and I'm going to see the cone of light, which is at the anterior inferior quadrant. And I'm looking at the tympanic membrane, and I don't see any bulging of any sort. I don't see any fluid. I don't see any redness. I don't see anything like that. I don't see any foreign bodies, and I don't see any wax accumulation. So I'm going to put that down, and now I'm going to go to the nose. And from the outside, I don't see any, the septum looks midline at this point, okay? And I'm going to palpate and percuss the sinuses, okay? So you just let me know if there's any tenderness, okay? All right, the frontal and the maxillary sinuses. Now I'm going to percuss, okay? Okay, no tenderness?
No.
All right, great. So, hold on. So I want you to close one nostril for me with your finger, and testing the patency of her nostrils. So take a deep breath in and out. Do the same with the other one. All right, great. Okay, so I'm going to test the cranial nerve number 1, which is the olfactory nerve. Okay, so I'm going to have you close your eyes. You didn't see this. And I'm going to rip it open, stick it under your nose. What do you smell?
Alcohol.
Yes. Okay. And then I'm going to take my otoscope so I can look inside of her nose. So I'm going to look inside. I'm going to get closer and actually insert it if this was real. I'm looking at the turbinates. She has the inferior and medial turbinate. I don't see any polyps. The septum is midline, and the mucosa seems moist. All right, I'm going to do the same thing with this one. Turbinates, mucosa, and septum is midline. All right, so that's nose. So now we're going to do mouth. The skin on your lips doesn't appear overly dry, and I don't see any evidence of cyanosis. So I'm going to have you open your mouth now. All right, and use this again, the light, and all right. Anyway.
Oh, what happened? Oh.
Okay. So I'm looking inside. There doesn't appear to be any teeth that are missing. The mucosa seems moist. The hard palate, I don't see any sores, and I don't see any evidence of yeast on the tongue or on the soft palate. The uvula appears midline. The pillars and the tonsils are present there, but there's no redness or swelling. Can you lift up your tongue for me? All right. Underneath the tongue, I don't see any sores. I don't see any lesions of any kind. All right. So now, can you swallow for me? And can you stick out your tongue and say ah?
Ah.
All right. So that's testing nerves number 9, 10, and 12. Which 9, I can't remember the name. 10 is, oh wait, it's 10 is vagus, 12 is hyperglossal, and 9 is glossopharyngeal. All right, so that was that test. And now I'm going to take a look at your trachea and your thyroid. I'm going to go around the back, but just for the video, can you stand up for me? And I'm going to stand directly in the back of you. I'm going to put my hands around your neck. Now, I'm going to feel the trachea, and it seems to be midline. And then I'm going to feel the cartilage, and right underneath that is going to be the thyroid. So I'm going to have you swallow. And I feel the thyroid go up and down. So that appears to be normal. Thank you very much, Karen.
Thank you.